Hi, today is the 26th of January 2018 in New Zealand, and I want to welcome our Birthing Better family and all of those that follow these live Facebook talks about debunking the myths around childbirth. There just seem to be so many, and today we're going to debunk the myth that women who are obese have difficulty birthing. Often we have confusion between issues that come into pregnancy and issues that arise in pregnancy, and even issues that arise in birth, with whether people are having difficulty birthing. So we need to separate those things. In other words, if a woman labors and her labor progresses and her baby comes out in a reasonable amount of time, in a reasonable second stage, and she has coped well with birth, then she can have as many problems as you can imagine. It doesn't matter the number of risks or the problems she brought in before pregnancy, that developed in pregnancy, and even those that developed in birth are not related to how effectively a woman gets her baby out of her body, or how easily a baby moves through a woman's birthing body, and how well she copes with the natural occurring pain of labor. And this is important for you to understand. If you have a high BMI, or you're fat, or you are obese, or you have a concern about your obesity or your weight when you were pregnant, yes, there are some risks, and you may know about those risks. You may have diabetes or high blood pressure, and those are risks. And as I did a little bit of research, preeclampsia, which is basically a kidney problem, is a higher risk with women who are obese when they are pregnant. However, you need to understand that those are factors. That doesn't mean that those risks necessarily become a problem. And what you need to understand is your baby isn't coming through your external body. No matter how obese you are, your baby doesn't come out anything externally. Obesity is external. Yes, there are factors with visceral fat, but visceral fat also has nothing to do with your pelvic bony structure. The space in your pelvis, you're being able to map your pelvis, the side-to-side dimensions between the sit bones, the bones you sit on, and from your pubic arch or your vagina to your tailbone. Those are your bony structure. Your bony structure doesn't change based on your external weight or even the visceral fat that people have. And thin people can have a lot of visceral fat. So when you're thinking about your pregnancy and your baby's birth and your risk factors, or whether those factors are going to become problems, the obese families, and there are many obese families who are birthing better families, they were able to disconnect that other concern with just learning about their bony structure. And so they mapped their pelvis. Some women who are obese have trouble feeling down there, but they had partners, most of them, who could feel down there. So their partners felt down there. And obese women aren't the only ones who have trouble finding the bones they sit on, or being able to measure down there. All of us have an awkwardness because most of us haven't been asked to do that. Yes, we wipe ourselves down there, and women who are obese wipe themselves down there. So we have to understand that knowing and finding and touching our body is something that we're just not as familiar with when it comes to preparing for birth. So if you are obese and you're pregnant now and you have a concern about your pregnancy and your birth, yes, you need to talk to your obstetrician or your midwife about it. But from a birthing better perspective, we want you to understand that if you map your pelvis, know the shape your baby has to come through, if you learn how to create space using the hip lift, if you learn the best position so that you can read the baby's contractions and make certain that you have a labor that has a bell-shaped contraction rather than flat contractions, if you learn how to use your breathing, good breathing patterns, so that you can have breathing that adjusts and adapts and is sustainable through the natural occurring pain of contractions, that you can birth your baby just like anybody else. Your weight then does not become a factor. And this is where debunking the myths around childbirth is so important. When these skills developed in the early 1970s, there were a lot of obese women there. Has obesity increased? Well, probably it has. There were a lot of women who had experienced sexual abuse when they were younger. Has that occurred? Well, it's in the news now. But we had to learn to separate those issues from what was important to our baby. And what was important to our baby was our baby's ability to come through our pelvis. That was important. It's a hard structure. And we had to learn how to reduce internal tensions inside the tissue that covers that hard structure. So the skills like the pelvic clock, where we soften inside our pubic bone, we soften inside our right hip. And not the top of our right hip, but the right hip above where our leg bone attaches, because the top of our vagina is like a clock face inside our pelvis. And our cervix is part of that clock face, and it's in our vagina. And our uterus is in our abdominal cavity. So our uterus grows, and it becomes part of this tissue that's the top of our vagina. And our cervix is there. We may never have felt it. If we have sex often, our partner will bump up against it, and it can be uncomfortable. If we use tampons, we often go fishing there, and we can find the top of our vagina. And most of us can find the front part of it easily by just putting our finger where we pee and then just going up on the inside of that soft tissue that you can feel the bone there. And then you just move over to this, so hard to show it, okay? So it's like this. You go in and you feel, and then you just move over. This is the top part of your vagina. You can't feel all the way back to your sacrum. You can't feel all the way back to each side of your hip. You can feel the cervix if you can reach back there, and when the cervix dilates, it comes all the way to the inside here. So as we learn more about our body and feel comfortable about our birthing body, we can recognize where our baby is. So if we go in and we can feel a big curve of our baby's head, then we know that a large part of our baby's head has already come through this bony structure. If we go in and we can't feel the baby's head, then the baby's higher and still has to come down, which means we can feel the baby at our belly. And it's true, women who are obese sometimes have difficulty finding or feeling their baby from outside their body. But we still feel our babies kicking and moving. And sometimes it takes a little patience to feel the baby. And sometimes it takes someone else to help us feel the baby. Often we can feel the baby's head on top of the pubic bone, here. And we can feel it. It's a hard object. And as we get more familiar, we get more certain about ourselves. We know something more about ourselves, which gives us confidence. So just like thin women, we have a lot of very thin women who go, well, I was told I'm tiny, and therefore I'm going to have difficulty birthing. And in 6 hours, they birth a 10.5-pound baby. Well, how is that? That's because when they map their pelvis, the distance between their pubic bone and their tailbone is long, and the distance between their sit bone is broad. So they have what would be called a typical woman's pelvis. But most of us, 50% of us, have different shapes than this open pelvis. And women who have open pelvises birth easily because their babies come down through that bony pelvis easily. But most women are either wider side by side and shorter front to back, or wider front to back and shorter side to side, which means your baby has to navigate that space, whether you're thin, regular weight, or obese. So as we learn about our inner pelvis, as we learn how to soften inside the pelvic clock, which helps the cervix dilate, when we learn to do the internal work that prepares the inside of our vagina, then we are just a normal woman giving birth. Now, if you are obese and you're saying, well, I can't reach my vagina and do that, well, yes, remember, you do wipe yourself. You wipe yourself front, you wipe yourself in the back, which means you're already down there. So if you have a concern, and you're not the only one, a lot of women say, how do I do the internal work myself? Well, on the audio tape in Birthing Better, your partner is taught how to do it first. And 80% of fathers will help you do the internal work because they want to help. They want something to do, and they're fascinated. So it helps them know what's inside you. But if some people who have strong religious beliefs, their partner isn't involved in this. So we had to figure out, how do we do it ourselves? And what we found is that you have to work on the opposite side that your thumb is facing. So when you're doing the internal work, just put your thumb in front of you. Which way is it facing? Well, it's facing that way, right? So you have a big belly. That's okay. Lean your belly that way. And you can put one leg up if you want, but lean that way. You can sit on the toilet. And then you just go in to that side of your vagina, your birth canal, and you work that area as far as you can reach, is up towards in the back particularly. You tense your muscles up down there and see what happens, then soften and relax them. And you work the area. And then you can work from the outside and the inside as well. And just keep working that whole area. And when you're finished with that side, take thumb out, put your other hand up there, lean over, go down and work that area again. And work between the vagina and your rectum, on each side of your rectum. And do that for 5 minutes every day from 32 weeks onward. And that opens up that soft tissue. And women who do a lot of internal work, and they say, I've done my homework. How do they know they've done their homework? Because their second stages are so short, and they don't have to push and break capillaries in their eyes. Their soft tissue opens up to this big object, and their babies come down much more easily. They don't have a ring of fire. They feel much more control of second stage. So if you are an obese woman who is pregnant now, really don't think about those factors as much as preparing your body for birth. It will serve you well, because obese women they birth just like the rest of us do. Skinny little women birth just like the rest of us do. You know, if your pelvis and your baby are a good fit, you'll birth fine. If your tissue, if your baby's birth canal isn't too tight, you will birth fine. If you're coping well with a natural occurring pain of contractions, you're going to birth fine. So how can you help us at Common Knowledge Trust to spread the word? Share these videos with your friends and other social media sites and other sites on Facebook. We can't post in other groups. We'd love to, but we don't think that that's probably polite. Know that we have all these debunking myths on YouTube. Like our page. Comment on our page. Purchase the Birthing Better skills for yourself or for friends. If you have a family member who's pregnant, work through the skills with them. You'll totally enjoy it. These skills were developed by us, ordinary women, ordinary men. We've included everybody in our learning. That way they help us, right? And for goodness sakes, even if you don't use Birthing Better skills for your birth, please become skilled so that you birth your baby. No matter where you birth, no matter who's with you, and no matter the circumstances around your birth. You don't get to give birth frequently in life. Even if you have 20 children, it's only 20 times. So for goodness sakes, learn the skills to birth your baby. It's well worth it. You'll have wonderful birth memories if you remember how skillfully you worked through your baby's birth journey with your baby. So see you again tomorrow, and we'll debunk another myth. I swear to God, we will run out of myths to debunk, and we will get into the truths around childbirth. But you have to bear with me, because there have grown heaps of myths around childbirth. So see you again tomorrow. Bye-bye.